Hello, everybody. Really glad to be here. I'm Mirana Pavlova. I'm responsible for the European project in GATE Big Data Center of Excellence at Sofia University. And as it has been mentioned by my colleague Laura in the previous panel, we are coordinating the VELES Excellence Hub, which is actually aiming to develop a regional smart health data space in 4 countries, in Bulgaria, Cyprus, Greece, and Romania. While smart health is one of the strategic European value chains, and it's very clear what it aims for, I would like to make a short reference towards the data spaces, the European data spaces, and what they stand for. Actually, these are considered as the main instrument to boost the European data economy. And according to the Big Data Value Association, these are frameworks that support data sharing and sharing of data assets within data, the so-called data ecosystems. And they have 5 very important elements. First, the data that is interoperable. There is a free movement of data. And of course, it is aimed to create value. Of course, the sharing is done in an open democratic way, but of course it should be regulated and aligning very much to the European regulations. People are also important element with the aspects of privacy of data and the fair usage of data, and also the skilled workforce that is able to work with the data spaces, the organizations that share and also use data, and the creation of new disruptive business models is another important element. And all of this is supported by standardized technologies which are trustful and can support the different aspects of the data space. While talking about the ecosystems, actually, we in VELES are aiming to create a regional ecosystem in all these 4 countries and to involve the different stakeholders in it and to create, of course, the benefits and the value for all the different stakeholders. Starting from the researchers, we would like to boost their research with more data, more relevant data, and more high-quality aggregated data. Of course, to help the innovations, to enable data-driven innovations in the healthcare domain. Also to help the policymakers at regional level and also at European level. I will come to this in order to elaborate the relevant strategies, the relevant policies in terms of health data and data sharing, not just within the countries, but also across the countries. And last but not least, we are aiming to provide for the citizens high-quality healthcare solutions. The overall concept related to the research and innovation strategy is building on several elements. The first one is the so-called Dream Design and Deliver framework, where we actually involve actively all the different stakeholders from academia, from research, government, practitioners and medical experts, and also citizens. Actually, a part of the consortium is covering very well the quadruple helix model, having all these representatives in the 4 countries. But in this framework, we are also gathering the feedback and actually the view of all these stakeholders. Now we are having more than 100 stakeholders all across these countries. And then based on this framework, on the concrete concepts and the concrete context in these countries in terms of digital health, we are building the so-called regional smart health data space, considering the different perspectives from one side, the technological, but very importantly also given the sensitivity of the health data, the ethical, the legal perspectives, and also the business perspective. The data space is aligned with, so to say, de facto standards, technological standards like IDSA and Data Space Support Center to build its own integrated services architecture and infrastructure. And based on this, we are developing, so to say, long-term research and innovation strategy, forward-looking, also the investment plans with the according action plans, and also different opportunities for public and private funding. And all of this will be tested through 4 pilots in the 4 countries, with Alzheimer in Bulgaria, dementia in Cyprus, cancer in Greece, and cerebral tumors in Romania. Going to the different aspects of the data space, as I mentioned, the technological framework is building on the very strong de facto standards from one side on the International Data Space Associations, which is also a partner within the consortium for defining the different roles in the data space and the different components, the so-called data connectors and the data protocols. But we are also our partner in the biggest initiative at European level, prescribing the so-called blueprints or the main components, which is the Data Space Support Center. So we are also aligning very much to these blueprints in terms of interoperability, trust, also governance, and of course, the business perspective. And speaking about the health data, as I mentioned, it's a very sensitive data. We consider it as a very valuable and put a special emphasis on its effective management and also the governance within the data space of this data, considering sovereignty, privacy, fair usage, of course, ethics, liabilities, and regulations. And when speaking about regulations, we are very much aligning to the European Health Data Space Regulation that has been issued last year for the setting up of the European Health Data Space for the secondary usage. So we are in a very good position actually to contribute very much towards the development of the common European Health Data Space. And of course, last but not least, the data spaces are developed with the main objective to create value for all their stakeholders. And as I mentioned, smart health is one of the strategic European value chains. So the main objective of our project is also to create value to all the stakeholders across this very important value chain. So thank you very much. I hope I managed to fit in the time, and we are very interested to collaborate with all the other projects and especially the ones that are in the health domain. Thank you.
Thank you very much.